If you've ever had a kidney stone, or know someone who has, you know the pain is, well, it's something else. It's one of those things people talk about being just unbelievably painful. But here's the good news. If you're facing one, you have some amazing options. So in this explainer, we're going to walk through the modern treatments that can get you feeling better fast.
You know, a lot of the time, tiny kidney stones can pass on their own. You drink a ton of water, grit your teeth, and eventually it's over. But what happens when it just won't? When that pain ramps up and it's clear the stone is stuck, that's when it's time to call in the professionals.
So how do you know when you've crossed that line from "I can handle this" to "I need a doctor"? Well, that intense, wave-like pain in your back or side, that's the classic sign. But you gotta keep an eye out for other things too. Seeing blood in your urine or feeling really nauseous, those are big warnings. And if you spike a fever or get chills, okay, that's a red flag. That could mean you've got an infection and you need to get help immediately.
Okay, so you know you need help. The fantastic news is that we've come a long way in treating kidney stones. From non-invasive procedures to minimally invasive surgery, modern medicine has a whole toolkit of safe and really effective treatments. Let's dive in and see what's available. When we boil it all down, there are really four main ways that doctors tackle problem kidney stones today. And these modern methods are so much better than the old-school surgeries of the past. We're talking less invasive procedures and way faster recovery times. So here's a quick look at the big four. Think of this as our roadmap. We're going to start with the least invasive option, ESWL, and go all the way up to open surgery, which is pretty rare these days. And as you can see, the right choice really depends on the size and location of the stone. Let's get into the details of each one. All right, you've got that stubborn kidney stone that just won't budge. What's next? In this section, we're going to do a deep dive into each of these four treatment options. The goal here is to help you understand what's out there so you can have a really productive conversation with your doctor about what's best for you. First up, we have ESWL. Yeah, I know, it's a mouthful. It stands for extracorporeal shockwave lithotripsy. But the idea behind it is actually super simple, and it's the most non-invasive option on our list. So get this, with ESWL, there are absolutely no cuts, no scopes, no instruments entering your body at all. Instead, a machine sends these really focused, high-energy sound waves right through your skin to the kidney stone. It's incredible. These waves literally pulverize the stone into tiny pieces about the size of sand that you can then just pass naturally. The whole procedure is usually done in under an hour. And the best part, it's an outpatient thing, so you go home the very same day. Over the next few days, all those little stone fragments just naturally pass out of your system. Pretty amazing, right? Okay, next on the list is ureteroscopy, or URS for short. This is the go-to procedure when a stone gets stuck in the ureter. That's the tube that connects your kidney to your bladder. You can almost think of it like a plumbing issue. The stone is blocking the pipe, and URS is the special tool the doctor uses to go in and clear it out.
Now, URS is a little more direct than ESWL, but it's still minimally invasive. Again, no cuts. The surgeon takes a super thin, flexible scope with a camera on the end and guides it all the way up to where the stone is. Once they see it on the screen, they use a tiny laser fiber to break it up into smaller pieces, which they can then pull out or just let you pass easily.
Just like ESWL, you're usually heading home the same day after URS. Sometimes, to help things heal, your doctor might place a temporary stent inside your ureter. And don't worry, a stent is just a tiny, flexible plastic tube that keeps the pathway open so everything can flow properly while any swelling goes down. They'll just take it out a few days later.
So what if the stone is just too big for those other methods? We're talking about a real monster stone. Well, that's when doctors turn to PCNL. This procedure is considered the absolute gold standard for stones bigger than 2 centimeters, or when you've got multiple stones.
Now, PCNL is technically a surgery, but it's still considered minimally invasive. The surgeon makes a tiny incision in your back, we're talking about 1 centimeter, like the width of your pinky finger. Through that small opening, they create a direct path right into the kidney, insert a scope, and then use special tools to break up and remove all the stone fragments. When it comes to big kidney stones, PCNL is incredibly effective. It has a success rate over 90% for clearing the stone in just one go. But here's the trade-off. It is the most invasive of these minimally invasive options, and it usually means you'll need to stay in the hospital for a day or two to recover. So, we've covered the 3 big minimally invasive options. But what happens if none of those are right for the situation? Well, that's when a doctor might talk about open surgery. But I have to stress this, thanks to all these amazing new techniques, this has become really, really rare. Open surgery is what it sounds like, a major operation with a larger incision in your side. It's really only used these days for extremely large or unusually complex stones that just can't be removed any other way. And as you'd probably guess, the recovery is much longer, often taking 4 to 6 weeks.
Getting a kidney stone removed is such a massive relief. But the next big question is, how do you keep them from coming back? Well, the great news is there are some pretty simple things you can do in your daily life to seriously lower your risk of ever getting another one.
Let's start with the number one most important thing you can do to prevent kidney stones. Drink more water. Seriously, aim for about 8 to 12 glasses every single day. Staying hydrated keeps your urine diluted, and that helps flush everything out before those stone-forming minerals have a chance to clump together.
On top of drinking more water, a few tweaks to your diet can make a huge difference. First, try to cut back on salt, because too much salt can increase the calcium in your urine. Now, this next one might sound a little strange, but eating calcium-rich foods like yogurt or leafy greens actually helps prevent stones. Finally, try to limit how much animal protein you eat. That can also help keep your urine in a healthier balance.
So, we've walked through all the options for getting rid of a kidney stone. But how do you find the right doctor to do the job? When it comes to these really precise procedures, let me tell you, experience really matters.
Think about it. Whether it's aiming shockwaves with pinpoint accuracy or navigating a tiny scope through delicate pathways, treating kidney stones takes a ton of skill. That's why it's so important to find a specialist, a urologist who does this all the time. You want someone with years of experience who is on top of all the latest techniques. But it's not just about technical skill. It's also about finding a doctor who is compassionate and who really listens to you. I love this quote from a patient named H.N. Ravi Kumar, who said he was grateful for Dr. Ramesh Makam's skilled hands and compassionate approach. Feeling like you're in good hands with a team that cares, that can make all the difference in your recovery. So as we wrap up, it leaves us with a pretty important question. Now that you know what's out there, what's the most important thing for you when it comes to your own healthcare? Is it the latest and greatest technology? Is it a doctor with decades of experience? Or is it that feeling of having a team that truly understands and supports you? It's something worth thinking about for any healthcare journey you're on.